This is the second part of my interview with Senior Consultant Orthopedic Surgeon Mr. Alistair Pace. In 2010, Mr. Pace was awarded the Fellowship in Orthopaedic and Trauma Surgery from the Royal College of London, after which he worked as a consultant for over 10 years. Mr. Pace worked in a large number of hospitals in the UK, alongside some world-class eminent orthopaedic surgeons. He has been awarded a number of very prestigious international orthopaedic awards and fellowships, and is an expert in upper limb surgery, shoulder, elbow and wrist, and hand conditions. I know you love the sea, and it was one of the reasons that brought you back to Malta. What do you love so much about the sea, and what sports do you do relating to the sea?
The sea has always fascinated me. I think it reminds me of when I was young as well, and memories of when you are young are always very positive and very pleasant. The sea has that charm to it, and just the smell, the sight of it. It relaxes one, and it takes you into a different place, different world. So even though you might have all the worries of work and stress of life, my family and I, when we go on the boat, let's say, and during the weekends, it stops me from thinking about everything else. And when I enjoy swimming as well, snorkeling. So, and when you dive into the sea and you see that the sea world, it's a different and new, completely. It's like being on a different planet, away from the noises of life, away from the distractions of life. It's untouched, natural beauty, and this has a particular charm to me, which attracts me.
Apart from the sea, what other pastimes do you have?
Well, I enjoy reading a lot, and one of the books I like reading about is Renaissance. I enjoy reading history and the Renaissance, but about the Medici family. I love Italy, and I love the architecture in Italy, and also the Medici and Florence, go hand in hand. And I enjoy reading about mostly art and sculpture. I have particular affinity to Greek and Roman architecture, and the Medici introduced these kind of neoclassical sites into Florence, and I find neoclassical architecture and Renaissance art very, very interesting and very attractive.
What about music? Is that important?
Yes, yes. I love classical music. I think it's very relaxing. Again, when I was very young, I remember I used to wake up to music on my alarm clock in the morning, and classical music, again, it relaxes me. It sends me into a different world where I can think clearly, and where I can meditate about life. And so classical music is what I try and listen to as much as possible. In England, I used to listen to a particular program, Classic FM, and on my way home from work after a long day of stress and work and problems, I just shut down, listen to the music, and it relaxes me completely, and try and take away all my problems of that particular day.
That's good. Can we talk a bit about your speciality? Orthopedic surgery in Malta. What are the most common problems that you find?
Orthopedics as a specialization is a specialization that has been developing over several years. From the time a few hundred years ago, when it was still in its infancy, today we have treatment and able to manage most orthopedic problems. Orthopedics, in fact, comes the word ortho and pedic, straightening children, which is where this specialization originated from, which means straightening children's backs, reference to scoliosis, a curved back. And since that time, obviously, orthopedics has now specialized, and we deal with all sorts of bone, joints, and soft tissue problems. I think in Malta, particularly, we do have a large number of arthritic problems in Malta, and we have a high number of hip and knee arthritis problems. I think part of it is related to genetic and hereditary, and part of it is also related to the type of work some people do. The management of these patients can be quite challenging, particularly young patients, and although there are options for treatment, not all options are always adapted to patients of particular age. The problem I find here in Malta, as opposed to my work in England, is that patients probably don't take physiotherapy and exercises as seriously as they would do in England. I try, as a consultant, I try and emphasize to patients that irrespective of what treatment you have, be it a hip problem, a knee problem, pills and surgery are not the beginning and the end. You need to try and do your part too. And that part is doing exercises and physio regularly. I mean, if you do physio and exercise regularly, then you build up the muscle around that particular joint, improve the pain, improve the stiffness. I think sometimes it can be difficult to get this message across to patients. I work very close with physiotherapists, and I try and liaise with them as much as possible, because I truly believe that the surgeon and physiotherapist both have a big say in the patient's recovery from a particular orthopedic problem.
Sure. It's very common, of course, all around the world. The knee replacement operations, the hip replacement operations. What is your view about when a patient should have these type of operations? Should they have it quite earlier on in the stage of their life if they have problems, or wait until a later stage when it becomes more critical? Because quite a lot of people tell me that they are recommended to have the operations when they are in their 50s or 60s, to give them 20 years of having a hip that works well, or a knee that works well.
Yeah, that's a very, very good question, actually. Now, you are always better with your own native knee. Yeah? Anything artificial is always artificial and never like your own knee. However, there are challenging questions here. I mean, if you have a young patient, for example, who has an arthritic knee, and this knee is affecting his quality of life. He can't walk, he can't sleep, his quality of life is generally poor. Sometimes you go through all the non-operative measurements, which may include physiotherapy, may include painkillers, they may include injections, and this patient still has quite a poor quality of life. And the only solution would be a knee replacement. Now, the questions there to ask the patient are, if we put an artificial knee replacement in you, anything artificial like the tires on the car, degenerate with time. So the plastic in a knee replacement wears away, the metal starts to loosen, the cement starts to come off, and they have a finite age, knee replacements. They last approximately maybe 10, 15 years. Recently, now with new technology, maybe 15, 20 years, but they have a finite age. So the question is, should you do this knee replacement, but with the knowledge that this knee replacement is going to fail? And then requiring a revision knee replacement will mean a bigger operation with more complications, with more risks, of thrombosis, infection, etc., etc. Or the other side of the coin would be: do you let this patient suffer with pain, have a poor quality of life, at that age? Now, the problem is these patients you mentioned, young patients, also work. They are in a working age. And having a knee replacement and having a job that's physical and manual causes knee replacement to degenerate or to fail earlier. So it's a big dilemma. I mean, I have replaced knees in someone, a patient who's 44, 45, I mean, I try and avoid them. And I try to tell the patient, try and prolong your own knee, and try and prolong the use of your own knee as much as possible with the measures I mentioned before. But there comes a time sometimes when you have to take the bull by the horns and decide the patient needs a knee replacement. And then the patient needs to accept the fact that there are problems and this might eventually fail and he might need a revision operation. They are challenging questions, sometimes not easy to come to.
So each individual is treated in their individual way,
exactly,
and according
yes,
to their
yes,
individual
yes.
needs. And finally, I'd like to speak about innovation in your speciality. What innovation will we see in orthopedics?
Yes, I think one of the innovations on the front line, which probably most people will have heard about, people watching us, are stem cell treatment. So stem cells are a group of cells which everybody has, and they are the originators of every cell in the body. So a stem cell is like a general cell, and then the body uses them to convert different cells. They may be skin cells, they may be nerve cells, they may be bone cells, and obviously those particular cells then produce the product required, be it cartilage, be it bone, be it nerve, etc. Now, we are living in a geriatric age. People are living longer. So people living longer obviously want a higher, better quality of life, and with age comes increased degeneration and arthritis. So at the moment, the way we treat arthritis is not by treating the actual disease or the cause, but either by treating the symptoms or by changing the knee, as we said, a knee replacement or hip replacement, whatever the case may be. Now, with stem cells, or what we call regenerative therapy, what we are trying to do is try to stimulate those cells to actually form a cell that produces cartilage, which is what is lost in arthritis. So, I mean, the technology for this is still in its infancy, and it has been used in the lab to try and grow skin and try and grow nerves, but for arthritis we are still in infancy. I mean, the technology is improving. I certainly see a future to stem cells. I mean, there are definitely advantages of doing it. At the moment it's a bit hit and miss, but I think that in the future, with further technology and developments, I think we may be able to start avoiding having too many knee replacements, let's say, and being able to develop cartilage in the lab which can be transplanted and used in patients with arthritic knees, for example, or arthritic hips, as the case may be.
Thank you. I know you spend a lot of time doing new research and keeping up to date, and that you very much believe in prevention that's better than cure. To close, how do we prevent disease and illness instead of having to go to have operations and other various forms of cure?
I think it's a difficult question, sometimes difficult to get across to patients, and patients normally address their problem after it has happened. As you rightly say, I mean, preventing it would be the first step forward. With regard to orthopedic problems, there is a big genetic element to a lot of what we see. Obviously, nothing can be done about that. But there are things that a patient can do, to preserve, protect, and to keep, let's say, his joints healthy. And this, in my view, involves regular exercise and regular physiotherapy. All right. So, if we adopt a healthy lifestyle, there are no magic foods you can eat that prevent arthritis or that prevent, orthopedic problems in the body. But adopting a healthy lifestyle, having a balanced diet of fresh fruit, white meat and vegetables, having an adequate amount of nutrients, plus having a lifestyle of not smoking and of not drinking too much and regular exercise, can improve the general welfare of the body, including the joints. The best exercises for joints are non-impact exercises. And here in Malta, in summer, we have the beautiful sea in Malta, and swimming is probably the best exercise you can do to exercise all the joints. The swimming helps, mobilize all of the joints or most of the joints. It helps, remove the stiffness of the joints. It helps also improve muscle around the joint, and gives also a general physical and psychological well-being to the patient. So in my view, exercise and having a balanced diet and also having a positive outlook to life together, are the ways you can, prevent as much as possible the onset of problems later on in life.